Okay, I think we've hit the noon mark. So good afternoon, everybody. Welcome to the Friday edition of Peterborough Public Health's weekly COVID situation report. Very pleased to have with us today MPP Dave Smith, as well as our board chair, Andy Mitchell. And as we get ready to dig into the current situation, I would just like to start with a quick land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, and with that, I will invite our board chair, Mayor Andy Mitchell, to say a few opening remarks. I'm pleased to announce that Mayor Mitchell was re-elected this past Wednesday evening as the chair of the Board of Health for 2021. So congratulations to you, and please go ahead, Mayor Mitchell.
Thanks, Brittany. For most of us, the start of 2021 has looked a lot like 2020. Not only is COVID-19 with us, but cases are higher than ever. Our healthcare capacity is once again being threatened, and we are in another lockdown. But be assured, it is different. In the spring, because of a lot of hard work by healthcare workers, including here at Public Health, and members of our community, we subdued COVID. But we didn't beat it. And this winter, it's come back out of the woods and is attacking us again. But this spring will be different. Thanks to the research and scientific community in Canada and around the world, we have a new weapon, COVID vaccines. This spring, we will not just subdue COVID, we will beat it. And although it will always be prudent to be on guard, life can begin to return to normal. Our challenge is to get from where we are today to summer. Please remember, COVID-19 can only spread through person-to-person contact. Limit the contact, limit the spread. Please, follow the provincial stay-at-home order. Although it can appear confusing, it's straightforward. Stay home. You should only leave for things you must do, not for things you may want to do. What is considered essential is defined in the order. It includes things like going to work if your presence is deemed essential by your employer. Otherwise, work from home. Going to school once they are considered safe by the province. Getting groceries, medical appointments, getting exercise, and helping others who are isolated. Socializing in person is not a reason to leave home. Even when you do leave for an essential reason, you need to follow public health guidelines. When outside your household, wear a mask and maintain a physical distance of 2 meters. Wash your hands frequently. If you feel ill, don't leave, even for an essential reason, and seek medical advice. Folks, I know you're tired and frustrated. Everyone is, and quite frankly, with good reason. COVID-19 is a cruel and relentless disease that strikes at a fundamental human need: to be social, to work and play together, to love. But we can't give up now. Even though it may not seem like it, the end is beginning to come into focus. Be safe, stay well, and in all things, be kind. Thank you.
Thank you, Andy, and thank you for your continued leadership during these challenging times. So with that, I'd like to invite Dr. Salvatierra to give us an update on the current COVID situation. Go ahead, Dr. Salvatierra.
Thanks, Brittany, and thank you, Andy, for those words. So as of 4:30 p.m. yesterday, we have currently 51 active cases that we are following. And so far this week, we've had 22 new cases reported to us. But we have been able to resolve some of them, so that's why the actual number of active cases has not changed since Tuesday. Already this morning at 9 a.m. we had 2 new cases for today, so they keep coming. In total, we are now at 459 cases for Peterborough since the pandemic began. Currently, my team is following 113 close contacts. These are high-risk contacts, that number is 31 less than Tuesday, where we were at 144. And our community remains at 5 deaths from COVID-19. As far as our new cases reported to date, and here we're showing you the breakdown of the last 4 weeks in relation to the number of cases that have been reported in the previous week. So there you see wave 1. You see that break we had in the summer with no cases. We went 6 weeks with no cases. Certainly cases increased very dramatically in the each week in December, and peaking at 71 cases for the week of December 28th. Last week, January 4th, we had another 49 cases, and since Monday so far this week, we're at 24. So it's still too soon to say whether we're seeing a decline at all since December, remembering that we are still within the 2-week incubation period from New Year's. What I really need is for the community to get tested. So if anyone has any symptom that's compatible with COVID-19, the message is that you should stay home, you should arrange for testing, because we really can't, it would help us to have some confidence in our local numbers if we know that people are being tested. These numbers can be artificially reduced if testing is lower than it needs to be. As far as our exposure goes, close contacts continue to be the highest source of our local cases. 65% of our cases in Peterborough are as a result of a contact with a case. Community spread, though, continues to be an issue for us. We are currently sitting at 22 of our cases in the last 4 weeks with no known epidemiological link. As far as the breakdown, the age and sex demographics, again, as with Tuesday, we see slightly more males than females, which is not the same pattern that is being seen in the rest of the province. The pie chart shows slightly more females with the cases that have been reported in the past year. When we look at the age breakdown, again, we still see the 20 to 29 age bracket representing the largest portion of our cases, 156 so far, and that is 6 more than last Tuesday. I'll go now just to give you an update on our outbreaks. We have still 2 active outbreaks in Peterborough. We're hoping that the outbreak at Community Living will be declared over this weekend. And our outbreak at Fairhaven remains stable with just the 1 case still. We are still receiving the testing results of residents and staff who've been tested again as part of that outbreak investigation. So I'd like to make some remarks, and that is that as our board chair has mentioned this week, the Premier announced a stay-at-home order for everyone in Ontario. And while there may be some confusion about the interpretation of what is an essential reason to leave one's home, I thought I would provide an example of a couple of real COVID exposure situations right here in our community, just to demonstrate how important it is to stay at home. These examples also give you a picture of what contact tracing looks like. So for the first scenario on this slide, what you're seeing is the index case in red. So if you can just follow and find that red index case in the middle of the slide there. This individual acquired COVID-19 from traveling outside of Peterborough. And during their infectious period, the individual did not follow public health measures and attended, you can see there, 2 parties and visited 2 other households. So you can see second from the bottom and far left. From there, other individuals visited other households, including one person who attended an institution and another party. What this graphic also shows, and what we learned from our contact tracing efforts, was that some individuals assumed that they were still operating in their social bubbles. You'll remember that at one point we had social bubbles, and they believed that their social bubbles were mutually exclusive and tightly controlled, when indeed they were not. So ultimately, this one index case in Peterborough resulted in 9 other active cases, as well as 17 close high-risk contacts, all of whom required ongoing follow-up from our public health nurses to ensure that they self-isolated to prevent the virus from spreading further. So that's what happens when people don't follow public health measures and don't remain within their household groups. If I could have the next slide, please, Brittany. Here we can see what happens to the outbreak when people do stay at home. The outbreak doesn't happen. This index case was already following public health measures to limit contact to household cases only, as did the other individuals living in the home. When this index case learned that they had tested positive, the only other close contacts were the 2 people living in the same home. The spread of the virus was well contained in this instance. This graphic also shows how our efforts today have real consequences for the future. Every time you limit your in-person social contacts and keep physically distanced from others, wash your hands, wear a mask, etc., you are actually affecting things in the future. So I hope that this helps to emphasize how crucial it is to follow the stay-at-home order. I also hope it sheds some light on the detailed detective work our case management and contact tracing staff do every day to help minimize the spread of COVID-19. And while I have your attention, I would like to add that our interagency vaccine planning table had its inaugural meeting this morning. We are working together to plan for phase 1 of our vaccine rollout. We are awaiting confirmation of our vaccine allotment, but have heard unofficially that we can expect vaccine to arrive the week of February 1st. To that end, we are working together to ensure that our 8 long-term care homes will be protected, and that that with their first dose of COVID vaccine by February 15th. We expect to receive the final lists from the homes today as far as their eligible residents, staff, and caregivers go, and also their in-house immunization capacity. I'm absolutely thrilled with the volunteer spirit in our community and the many individuals who are offering to assist us in these efforts. I have complete confidence that we will meet our target and that we will take full advantage of the vaccine when it finally does arrive in Peterborough. Thank you.
Thank you very much, Dr. Salvatierra. With that, now we will open it up to remarks from our elected officials. And I believe that MP Mariam Monsef has joined us. So MP Monsef, if you have any remarks that you would like to share, I'd be happy to spotlight you on the screen, or if you'd just like to be available for media questions, just let me know.
Thank you so much, Brittany. Yes, I do have some remarks, please.
Great. Let me just get you up here. There we go. Go ahead.
Thank you so much. Hi, everybody. Bonjour, Anin. Salam alaikum. I'm on Mississauga territory and so grateful to call this place home. So many reasons for that. First of all, local leaders in this community are coming together weekly, working together, rowing in the same direction to take care of our citizens and to make sure that we're coordinating our response. Since March, I've been convening local leaders, including our colleagues at Public Health, for a nearly weekly call, which has been a great source of strength for our community and I think for us as leaders. And I want to thank my colleagues for showing up and for going above and beyond the call of duty. Vaccines are rolling on and moving on track, and even with hiccups along the way, every Canadian who wants a vaccine will have access to one by the end of September. Our public health experts, our frontline workers, our essential workers, they too are going above and beyond the call of duty, and they're taking care of us and our loved ones in our most vulnerable hours. Most of our community members are making really tough choices too, and they're making sacrifices. They're avoiding getting together with their loved ones, with their friends, because our individual actions matter. We are all on the same page. We all want this pandemic to end. We live in a great democracy with systems in place to powerfully respond, and those systems are working and they're making a difference. But every individual in this community has the power to stop the spread of this virus so that we can give our health systems a break, so that we can allow for the vaccine rollout to occur, so that we can return to a new normal where we can all reconnect with our loved ones. We all have to do our part. It is going to be okay, but unless we all do our part, it will take much longer than it needs to for things to be okay. Thanks, Brittany. That's it for me today.
Thank you very much, Miriam. Great to have you joining us today. And now I'd like to invite our MPP, Dave Smith, who's here to join us. MP Smith, if you have any comments, you're welcome to share them now, and I'm happy to put you up on video if you'd like.
Sure, thanks, Brittany. I appreciate that.
Great. There we go. Go ahead.
Thank you very much for this. As both Dr. Salvatierra and MP Monsef have said, we are embarking on a vaccination program right now. I'm very happy to say that we are up to a point now where we can vaccinate approximately 40,000 people per day in Ontario, and it is increasing on a daily basis. We have capacity that is growing, and we're actually outstripping the ability to have vaccines sent into us. Our goal, according to General Hillier, is to be at 250,000 people vaccinated in a single day. That's what we're working towards, and I'm really looking forward to that day where we can have that many people get vaccinated. I know that there was a slight hiccup last night from Pfizer that they have made an announcement that they have to pull back a little bit and won't be able to send as many vaccines as they had been to Canada. That's a little bit disappointing. Hopefully we'll have other vaccine options coming soon from Health Canada, though. It will be a game changer when we're able to put vaccines into everybody's arms and we can move forward with it. I'm really looking forward to everything that is going on. What I will finish off with is this vaccine does not walk. Sorry, this virus does not walk. It doesn't fly. It can't move around unless it's moving with people. The stay-at-home order is very, very simple. Stay at home. If you want to go out, there's one question and only one question that you need to ask. Do you need to go out or do you want to go out? If you need to go out, by all means, go out. But if it's just you want to go out, consider delaying it for a couple of weeks until we lift this order so that more people have an opportunity to get better from COVID and we can stop the spread. Thank you.
Thank you, MPP Smith. Great to have you joining us today. So with that, I believe we will move on to our media questions. And I had promised last time that Jessica Nisnik could go first. So Jessica, would you like to go first or do you want to let somebody else go ahead of you?
I can go now, Brittany. Thank you.
Okay.
Hello, everybody. I have just a couple questions here. Dave, you mentioned that Pfizer is isn't able to necessarily fulfill what they had said they would. Last week, or on Monday, was it Tuesday? Miriam had said that we'd secured 20 million vaccines. Is the shortage that I'm not sure who can answer it. Is the shortage from that 20 million that we had secured?
I think that's a question that would have to go to our federal member on it. I'm just getting reports from our ministries that Pfizer has advised all countries that they are reducing the number of vaccines that they are sending out to everyone. They've had to shut down one of their lines.
I can provide an accurate update. Thanks for your question, Jessica. Due to work to actually expand the European manufacturing lines in the facility, the production of the Pfizer vaccine is temporarily delayed for a few weeks. This means Pfizer is temporarily reducing deliveries to all countries receiving their vaccines manufactured at its European facility, and that includes Canada. This delay in deliveries will have no impact in our long-term vaccination plan. We have secured the most diverse portfolio of vaccines with 7 agreements in place and the most number of doses per capita in the world. And we remain on track to meet Canada's vaccination timelines. We will have vaccines in this country for everyone who wants to be vaccinated by September 2021. That has not changed.
Thanks, Miriam. This could be for, well, it could be for Dave or it could be for Dr. Salvatierra. You know, with the new stay-at-home order, we know there's a lot of confusion. I looked at the Q&As from the government and it says, you know, they can't determine what's essential. They can't determine certain things, but we're leaving it to the public who has not been necessarily listening the whole time. So, you know, we're hoping that everyone does what they're supposed to do, but they haven't been. So those who maybe weren't staying at home before aren't going to stay home now. What are the consequences to this? Because just asking people to stay home clearly has not been enough. There seems like there needs to be some kind of consequences. So I'm not sure, Dave, if that's best for you or Dr. Salvatierra.
I can jump on that for a little bit, Jessica. There are consequences if you are going out and you shouldn't be going out. The police have the power and ability to fine you. Now, to say that if you're going for a walk to pick up a newspaper the police are going to pull you over and fine you for being out. That's not accurate. If you are consistently doing things that you shouldn't be doing, then yes, you are going to get fined at that point. But we recognize that there are things beyond just COVID-19 that make things that would seem non-essential to actually be an essential thing. And I'm going to relay part of an email that I received yesterday. Somebody was quite upset that you can purchase a vehicle by going to a dealership through an appointment to purchase a vehicle. And they said to me, this is not essential. On my way into my office yesterday, I witnessed a 3-car accident. 2 of those vehicles will be written off. If that person needs the vehicle to get to work, it's going to be essential that they replace the vehicle. If we said that you could not go to a car dealership, what would that person do? Now, if that person was a healthcare worker and couldn't get into the hospital, couldn't get to long-term care because they no longer had a vehicle because of an accident, what does that mean for the ripple effect? It really is as simple as this. Every time you go to leave your house, ask yourself, do I need to do this right now? Or do I simply want to do this? And if the answer is, well, I really want to, but I don't need to, consider not going out. It is that simple. It doesn't have to be any more complicated than that. For me to say that something is non-essential doesn't take into account the differences between all of us. What is essential in downtown Toronto is not the same as what is essential in downtown Buckhorn. If for your mental health, one of the things that gets you through the winter is ice fishing, then ice fishing for you is essential. And yes, you can go and ice fish. Don't stop at the convenience store and pick up a bag of Doritos. Don't stop at the beer store and pick up a case of beer. And definitely do not wander around and socialize with everybody who's on the lake ice fishing. But if ice fishing is essential for your mental health, you can still do that. And it would be wrong of me to say that is not essential. So I'll come back to it again. When you want to go out, ask yourself this simple question. Do I need to, or do I want to? And if the answer is I need to, go ahead and do it. If it's simply I want to, reconsider it and wait until the lockdown is over and then go do it.
Thank you, Dave. Just for Dr. Salvatierra or Dave again, where can, if people do have questions and they're unsure, is there a resource maybe on our website, Dr. Salvatierra, on your website, or is there a government resource that people can turn to?
We will be posting information on our website as we always do, Jessica. So thanks for that question. And I was just on a call this morning with the city and with the police, and I understand that they are developing some frequently asked questions, and that they will have those posted on their website as well.
That's great. Thank you. I think a lot of people just don't know, can they go for a walk? Will they get fined? You know, so that's really gonna help. That's it for me. Thank you very much, everybody.
Thank you, Jessica. And I think to make it easier, what I might suggest is that questions go to Dr. Salvatierra, and then she can invite any of our elected officials to fill in any additional information if it helps with the answering. So I will now invite Joelle from the Examiner. If you have any questions, go ahead, Joelle, for Dr. Salvatierra.
Okay. All right. I'd like to ask Dr. Salvatierra, we're hearing from concerned citizens today and yesterday who've noted that there's a limited number of high school students that are still attending school because they have special needs. There's a limited number, say at St. Peter's, and some passerbys have seen them outside without masks. So I'm wondering if there's been any calls of concern to the health unit about instances such as that one or any other in the last 24 hours.
So Joelle, I can't answer that first question because there may have been calls, but I wouldn't know about them. We do have a school health team that would be dealing with anything that's related to schools. Schools are open for, as you have noted, for special needs students who are unable to learn virtually at home. So we do know that there are students in the schools. Typically, they need mask breaks, and the best place to have a mask break is outdoors. So, without investigation, I would wonder if that indeed was the case. Were these students who were taking a much needed break from wearing their masks? And if that was the case, it's perfectly legitimate for them to do so.
Okay, thanks. That's about all I have for now. Thank you.
Thank you, Joelle. Okay, Taylor from Peterborough this week. If you have questions for Dr. Salvatierra, please go ahead.
Yes, thank you, Brittany. Just for Dr. Salvatierra, I think, as Jessica has stated, there's still some confusion about the lockdown rules. Maybe what are some do's and don'ts that you think people should be aware of? And maybe you can describe what are some essential trips that people are allowed to take out of the home versus some non-essential trips?
Well, essential trips would be, first of all, Taylor, if you were an essential worker that needed to be in the workplace. For example, I have many of my staff who need to be here. We are still offering clinical services. We have staff who need to staff our lines, our hotlines. They can't do that from home. So there are essential workers, and they need to leave the home to go to work. In addition, if you are providing caregiving services to a child or an adult, a dependent adult, that may also be a reason why you are leaving the home. If you need to do grocery shopping, although I must say my habits change from depending on what whether there are stay-at-home orders. In the summer, if I wanted to cook something for dinner, I could put on a mask and go over to the closest grocery store. I'm not doing that anymore. I think we're back to weekly shopping for perishables, planning your menus, planning to only go once a week. So that does mean changes in how people might organize their household meals. It certainly means not only, do I need this, but do I need it now? Or is this something that can be deferred? If it's a light bulb, do I need it now or can it wait? So making those decisions to reduce, not only, eliminate day-to-day trips outside of the home, but reduce the number of times that you are leaving the home and seeing if you can consolidate those visits, keeping lists so that when you go out to the drugstore to get your prescriptions, that you are also picking up some of those other essential items and making the most efficient use of those risky times. Because remember, we do have COVID in the community, and each time you go out, you are taking a risk. So doing a risk benefit analysis and making sure that it's worth the risk. Some things can be deferred, even if you think they are essential. And when we do go out, recognizing that right now, you need to be wearing a mask or a face covering if you are going indoors. If you have a medical exemption, I'm afraid the days are long gone where you could just go into a store without a mask. I'm expecting anyone with a medical exemption to prepare to be accommodated, which means wearing a face shield. They're not as good as face coverings, but they do help decrease the risk for others. So if you do have an exemption, and if you can wear a face shield, be prepared to wear a face shield, or be prepared to change how you shop. I think the best news or the best advice I can give anyone is that if you can do curbside delivery and not even go in the store and wear a mask and keep a distance, or if you can have things delivered to your home, that those are safer ways to fulfill some of those essential tasks that we all need to do in order to stay safe during this pandemic. I hope that helps.
Yes. Just wondering about continuing the topic of what are essential trips out of the home. Because there are some businesses that are still open, but might not necessarily be considered essential by the majority of people. Things like, you know, ordering takeout at restaurants and doing curbside pickup for that. What are your thoughts on those types of businesses and going out and doing those types of trips?
Well, if you can cook your own meals at home and can, prepare your own meals at home, that is a safer option than having to go out to pick up food or having it even delivered. So there's degradations of risk and benefit. On the other hand, though, not everyone can cook. Not everyone might have what they need. Sometimes you need a break. A mental health break from even some of those, daily chores. And so we do have premises in the community that are prepared to provide you with some additional options like takeout or delivery. They are all following the public health measures and the guidance, and my staff are working very closely with those food premises. So they are also trying to stay afloat in these very difficult times. So I think if you want to help those businesses and provide them with some of your services or needs, that they are also a good way to, and a low risk way to have some of your daily needs met. I don't know if MPP Smith would like to also answer that question. MPP Smith?
On what is essential and what's not essential?
I think the question that Taylor had about takeout food and delivery, and yes, what is essential? Why are some businesses open, and the question about what is essential and what isn't?
Ultimately, Taylor, it comes down to this, that we have a lot of businesses that some people would deem as non-essential, and others would say it absolutely is essential to them, that it's open and they have those options. As Dr. Salvatierra rightly pointed out, sometimes you need to be able to take a mental health break from whatever it is you're doing. By all means, if you have the ability to cook dinner, make your lunch, make your breakfast at home without having to go out, without having to order out, that is by far going to be the safest way of doing it. If you plan your meals out for the entire week, then you can go grocery shopping once and buy everything that you need to make those meals. Sometimes it doesn't always work out quite that way. So having the ability to order in, yeah, that is something that can be helpful. What we really need, though, more than anything else, is for as many people as possible to recognize that the virus only moves with people. And the less the people move around, the better it will be for all of us, and the quicker we can come out of this. So take the opportunity to do more things at home. Take the opportunity to spend some time in your yard if you have a yard. Take the opportunity to read a book, to do different things than you would normally have done, but do them at home. Stay at home as much as possible. That's what's going to do the most for us.
Last question then. I don't know if this would be oriented to Dr. Salvatierra or Dave Smith, so I'll just throw it out there. I'm seeing social media posts from people saying, oh, well, I know someone who's been pulled over for police and they were fined because they weren't essential. They weren't doing an essential trip, or I've been pulled over. All of these posts that I've seen are making these claims without any evidence. So I question their credibility. But I'm just wondering if Dr. Salvatierra or Dave, if you've seen these messages and if what your response has been to these, or if these messages have made their way to you.
Well, I will begin, Taylor, by saying that our Peterborough police are not doing random stops for COVID compliance and or the stay-at-home order. And in addition, for example, I've certainly heard from employees who are, quite anxious about having to come to work because they are essential and they need to leave their homes. So we do not, employers are not required to provide them with letters, and so employees do not need to have a letter saying that they are essential workers. So I think we can all take a breath and relax a bit about what this means as far as if you are having to leave the home and it is essential that you will not be stopped and quizzed about this. And with that, I will ask MPP Smith if you have anything further you'd like to add.
Thanks, Dr. Salvatierra. So yesterday on social media, there was a report that Peterborough Police were randomly pulling people over on Chemong and asking them where they were going and why they were out. The reality is, yesterday there was a speed trap on Chemong because the speed limit was reduced, on one section of it, and people weren't observing that. I did have the opportunity to speak to the police yesterday about it, and they have assured me that they have not pulled anyone over randomly to find out if their trip was essential, that people have been pulled over because they have been speeding, and that was the only reason that they were being pulled over. There are a number of reports that people are admitting are third and fourth hand. There is nothing firsthand. I have not seen anything firsthand. I have zero evidence across all of Ontario that the police are checking why you're out. What I have seen is misinterpretations of someone being pulled over because they were speeding and someone else making the assumption that that individual was being checked for why they were out.
And if I could just add to that, Taylor, the police will be preparing and posting frequently asked questions on their website. I would anticipate that that will be ready soon, and that would be a good place to direct any further questions.
Okay, that's awesome. Yeah. And I haven't seen any firsthand accounts either, for what it's worth. So thank you both for answering your questions today. Much appreciated.
You're welcome.
Thank you very much, Taylor. Okay, I will now invite Matt Latour if he has any questions. And I also see Graham Elliott on the line, so maybe you can let me know if you both are planning on asking questions of Dr. Salvatierra or if it's just you, Matt.
I think it's just me. Graham's just kind of listening along.
Okay. Right,
I only had one question for Dr. Salvatierra, and that had to do with the number of active cases we have. I know it's been kind of holding steady in and around the 50 to 55 range throughout the week. Is this something that's encouraging to you to see that it's not rising, or would you like to see it go down?
Oh, well, I think we all would like to see it go down. I think there's a great deal of anxiety, Matt, as to what's going to happen with this UK variant that is being detected in parts of Canada and in Ontario. And of course, we've had recent reports from York, the region of York, where they have found cases that are unrelated to any travel or exposure to people who have traveled. We know that the variant is more easily transmitted. And so if that's the case and it gets a foothold here, we will see our cases start to increase again. And I do worry about outstripping our capacity. We're a small health unit. We have a small population, but it doesn't take much to overwhelm us. And then once we are overwhelmed, and that has happened in various parts of the province, once you lose control of your case and contact management, it's very difficult to get it back. And so I mean, I am encouraged to see that the active number of cases has not increased, and that we've been able to reduce the high risk contacts, the totals, but we need to get those down even further. The other benefit of reducing our numbers is that frees up additional capacity for us to put towards vaccines. And so we're currently building our our mobile teams that will be going into long-term care homes to support them. And the more staff I have, the stronger those teams will be.
Do you think we've seen the end of the surges from the Christmas and New Year's holiday break?
Not necessarily. I mean, we are just on the edge, on the cusp of the incubation period, January 14th, so 14 days after New Year's. My worry is that if we had cases that arose because of the New Year's holiday and they didn't get tested, so we don't know about them, but they socialized and spread the disease, that there may be a delay in our identification of transmission in the community. So we have to sit tight. I think we need to wait longer to see if we in fact have been able to prevent and any transmission, and I am encouraged, but it's still early days.
That's it for me. Thank you.
Thanks.
Okay, thank you, Matt. So I see Paul Rellinger also here, and Paul, you'll be our final reporter. If there's anyone I've missed, though, from the media, please indicate through the chat function, and I'll make sure to queue you up after. But for now, I will invite Paul to ask questions of Dr. Salvaterra. Go ahead.
Thanks so much, Brittany. And a couple questions for Dr. Salvaterra, if I may, and a clarification. When we look at outdoor activities, which are being allowed, rinks are open in Peterborough, trails. I just want to, I think I know the answer to this, but I think it bears repeating that people are strongly encouraged to wear masks during those outdoor activities.
Yes, Paul, and if you can help us get that message out, I would be very grateful, because that is sort of the next evolution of our public health advice. We are recommending that if people are using the amenities like trails and ice rinks, we do want to keep them open. There are capacities that need to be respected. There is signage indicating how many people can use that rink. And so we ask people to observe those limits, not to use the amenity if it's already full, but to either go elsewhere or to wait. And definitely our trails and even our sidewalks, Paul, are narrow enough that if more people are out walking, that we are advising that face coverings be worn. Also, I think it's important to understand that the limits, the outdoor limits, have been reduced to 5, but that's anticipating that most of those will be households who are out together. If you are out, again, you are not to socialize, and you are to keep 2 meters distance, and you are to wear face covering. That really is the safest way to go about using our beautiful outdoors here in Peterborough.
Thank you. And regarding the vaccine and its imminent arrival for long-term care, we've heard much talk, and I know you have as well, about people saying, well, you know, I'm not sure if I want to get the vaccine. I'm not comfortable that it's safe, and which is totally another question altogether. But the point I'm getting at, in the off chance, and it could happen, that a staff member of a long-term care home refuses the vaccine, I guess what I'm looking to find out, would they be allowed to continue to work there? Would it be in a condition of their employment? I mean, it could happen.
Well, Paul, right now, the plans are that the vaccine is completely voluntary. So I am hoping, I have written a letter to every long-term care home staff person in Peterborough. I am asking that they truly consider this as something for their own benefit, but also as a benefit to their patient, and that they are taken care of. So I am hoping to see our rates high in Peterborough. I'd like to see those rates over 75% of long-term care staff. I know that, for example, with influenza immunization, we have some long-term care homes and retirement homes that are just doing a wonderful job. Those staff, we have very high rates of uptake of influenza vaccine. So I am still optimistic and hoping that we will see high uptake, and I'm going to do everything I can, Paul, to provide them with the information that they need in order to make the best decision for themselves and for their patients.
Great. Thank you. And just a clarification, if I could, and then I have a question, if I may, for MP Smith. On the testing front, the number on Monday was 41,100. It's 40,300 today. So it's gone down for some reason, and I just wanted to find out what that was all about.
Thank you. We'll look into it and get back to you. I can assure you that we are testing more people every day, and that the North Crest Arena is heavily subscribed. So I'm sure there's probably a technical reason for that, and we'll look into it. Thank you for alerting us, and I'll give MPP Smith the floor for your next question.
Thank you, Dr. Salvatore. I thought only journalists made mistakes, so so I appreciate that, and I'll look forward to getting that new number. MP Smith, if I could, there's been much talk about big box stores being open when smaller businesses are not. And also a lot of discussion around, well, the big box stores are open, they should be open for food only. Their pharmacies should be open. No one needs a TV during the pandemic, a new TV or a new stereo system or whatever. Has the government looked at this as being a feasible option? And if it's not being done, what's the reasoning behind that?
Thanks, Paul. I appreciate that. And actually, yes, we've had a large number of discussions about it. We've looked at different scenarios on how we could make it work. And for the most part, I would agree with your statement that nobody needs a new TV right now. However, if you're locked in at home and you're not able to do something and your TV is broken, perhaps you do need a new one. And there's a lot of other things that get taken into account. And I'll give a couple of specific examples. If you have a young child that is growing rapidly, you're going to outgrow a lot of the clothing that you have or that the child has. Having the ability to get something is something that is a necessity. Having the ability to replace snow boots, having the ability to get another coat, hats, mitts, those types of things do become essential. We don't want to be in a position where we're creating an unbalanced field and we're unduly punishing a small business and letting one of the larger stores that sells multiple things stay open. But when you look at the travel itself, let's take downtown Peterborough as a perfect example. It has struggled significantly during this. All of the stores are small stores. And in order for you to buy multiple things, you're making multiple stops. And that's multiple contacts. That's multiple opportunities to spread the virus. We're trying to reduce the number of opportunities you have of having contact with others and the number of opportunities you have of coming in contact where there may have been an exposure. We're never going to find a perfect solution to it. And we're trying very, very hard to make sure that we can meet the needs of everybody. During this current lockdown, we have a number of supports in place for businesses. There is the $10,000 to $20,000 grant that we're offering to all businesses that are in a position where they are shut down or have had a significant reduction in their business as a result of what's happened with COVID. Happy to expand on that at a later date where I'm not taking up everyone else's time. But there are lots of opportunities that we have to make sure that all of these businesses can come out of this lockdown. We need businesses to be able to open, and we need them to be there so that they can open once the lockdown is lifted.
Thanks so much, Dave. I appreciate your answer. And that's it for me, Brittany.
Great. Okay, thank you so much, everyone. Very much appreciate having you join us today. We will be back here again on Tuesday. So thank you so much. We're just going to get ready now for Dr. Salvatierra's vaccine presentation at 2 p.m. if you're able to join us on the on our YouTube channel. So with that, have a great weekend all, and we will see you back here on Tuesday. Thank you.
Brittany.
Oh, Brittany, are you still on the line?